Well, if you have a newborn or young child, there are some vaccine changes you need to know about.
Yesterday, the CDC reduced the number of childhood vaccines it recommends from 16 to 11. Our Liam Combs spent the day talking to some doctors and has everything you need to know. Liam?
Teacher and Chris, this is the latest push from the Trump administration's Make America Healthy Again campaign, putting the focus back on you, the parent, to do what is best for your child. But some medical professionals I spoke to today tell me the move could do more harm than good. This winter season, the number of doctor's visits for flu-like symptoms have hit a 30-year high, according to the CDC. But just yesterday, the same CDC wiped the flu shot off of the list of recommended vaccines for children. But it wasn't just that shot. Also no longer recommended are vaccines for both hepatitis A and B, meningitis, rotavirus, and the CDC dropped the HPV recommendation from multiple doses to just 1.
That one's a little scarier because the chances of a child who contracts hepatitis B early on in infancy, of them having major life-threatening long-term hepatitis B issues is higher than if you were to catch hepatitis B, say, as a 20-year-old.
Dr. Jacob Wood is a family medicine doctor at the Baton Rouge General Hospital. Recently, he says it's been getting harder to have conversations about vaccines with his patients.
Because even the data is suspect to people right now. Even the good data is suspect. Nobody believes anything right now. Everybody's just scared. And so it really comes down to going back to this personal trust that I have with my patients.
At the state level, Senator Bill Cassidy, also a licensed physician, says the drop in recommendations is the wrong move.
There's a doctor from California who speaks about how he acquired hepatitis B shortly after birth, didn't realize it until he ended up, I think, vomiting blood because his liver had just slowly destroyed itself over 40 or 50 years, and he did not even know that. It doesn't happen often. It happens often enough. You don't want it to happen to your child.
He says he has had conversations with the Trump administration about vaccines, but this time around his plea fell on deaf ears.
There's sometimes when I can tell you that a decision is made differently because of me registering my concern.
For Dr. Wood, he's just confused why something like a chickenpox vaccine was kept on the recommendation list and not hepatitis B.
Like it should be the other way around.
Now, with all of this stated, your local school district could still mandate vaccines before your child is enrolled in school, so you are urged to contact your local school for guidance on these changes. Guys.
Liam, thank you.